Hi, everyone. I'm Sandra Arevalo. I'm the Director of Community Health and Wellness at Montefiore Nyack. And today, in Community Chats, we have Matt Stryker, who feels like a friend already because he joins us. He has joined us a few times here in Community Chats, and it's great to have him because he is very knowledgeable about asthma. And he provides a lot of resources for families that are, very easy to handle. I have to say, even I have learned a lot about asthma from him. So I welcome you again, Matt. Thank you for being with us. And you probably want to introduce yourself a little bit and your company. And I think you froze. There you go.
There we go.
Yes.
All right. Sorry about that. I got dropped for a second, but thank you so much for the introduction, Sandra, and all of you for joining today. As Sandra shared, my name is Matthew Stryker. I work for a company called Amgen, which, if you're not familiar, is a biopharmaceutical company. And my specific role here is I'm a medical science liaison. All that to say, my major areas of focus are both provider as well as patient education. And really, again, want to thank Sandra for the continued partnership with the community chats and the opportunity to further engage the broader Montefiore Naya community as it relates to asthma education. So today we'll be focusing on a specific aspect of asthma care and management, which is the asthma action plan. And associated parts of that really feed into the asthma action plan. So I'm going to go ahead and screen share. And then from there, I will say, if you have any questions throughout the presentation, please don't feel like you have to hold them to the end. If you'd like me to review something again for clarity, please feel free to drop your question or request for a review in the chat. Let's make this informal and educational. So let me go ahead and screen share here.
So, Matt, I'm going to go behind the curtains. If you see me appearing, it's because there is a question, okay?
Okay, sounds. I could just once the screen share comes through, Sandra, if you don't mind just giving me the heads up that it's sharing.
Yes, it is.
Perfect. All right. Perfect. So we'll go ahead and jump into this. And as you may have seen in some of the communications for this program, the program itself is called LUMA. And this is an abbreviation that stands for Learn to Understand and Manage Severe Asthma. So we've got lots of different resources to help support yourself, perhaps as an individual affected by asthma, or if you're a caregiver for somebody who is affected by asthma, lots of different resources. But again, today we'll be focusing as is noted at the bottom, the asthma action plan in the journal that kind of complements that well. So just some important information to level set here. As I had previously shared, I work for Amgen, and then we have a sister company that we collaborate with, AstraZeneca. We are the sponsors of this program, and it is being presented in compliance with food and drug regulations. It is educational, and it's not to be construed as a representation for any specific therapy being safe or effective for treating any particular disease. So kind of our disclaimer slide right here, just to level set everything. Unfortunately, won't be able to get into specifics about individual medications, though we'll touch on classes of medications later on in the presentation. So before we get into talking about the asthma action plan, I think it's important to recognize and really appreciate how common asthma is specifically within the US. And we're talking about present day numbers. So if we hone in on the US specifically, what you can see is if you start at the left here, asthma is a very common condition affecting individuals in the millions. So you can see that upwards of 2.5 million people in the US have severe asthma. But more broadly, at the top here, about 25 million people in the US have asthma. So, like other conditions, patients can have mild, moderate, or severe asthma. how the severity is defined is based on the medications that a patient's taking for asthma. And of the 25 million, again, upwards of 2.5 million patients have severe asthma. And if we further hone in on that specific 2.5 million number, still over 1 million individuals with severe asthma have asthma that remains uncontrolled despite therapy. So there's opportunity to reflect on the why. Is it another condition that's leading to the lack of control for asthma? Is it challenges with getting the medications, challenging using the medications? There's lots of moving parts, and sometimes it can be challenging to really hone in on what specific um, uh, issues are causing the challenges for the lack of control for an individual. But we'll work to identify those together in certain aspects of the asthma journal and action plan. And I'd just like to call out, so we honed in on specifically asthma patients within the US, but if you're more interested in what's taking place more locally, perhaps within your state or more granularly, even within your zip code, feel free to scan this QR code. And this resource here will link you to a platform called Epicentral. And essentially, it provides claims-based information, honing in on the same kind of facts that we just looked at, both patients with asthma as well as patients with severe asthma, but gets a little bit more local. So if you want to check out the Nyack zip code or the New York State, please feel free to scan that QR code and it will link you out to a nice heat map that you can play around with here. And as we talk about asthma, it's important to recognize that despite how common it is, there are serious consequences if left untreated or left unmanaged. So, according to data from 2019, asthma was associated with almost 200,000 discharges from inpatient hospital care, up to 1.5 million emergency department visits. So in other words, patients either went to the emergency department for asthma or were discharged with an asthma diagnosis or related diagnosis pretty extensively when we look at 2019 numbers. And these are some of the quote unquote, like the more hard targets or numbers that are focused in on when we talk about asthma control and improving control, which would be reducing emergency department visits, as well as reducing inpatient hospitalizations. And of course, important to you all as either the individual with asthma or a caregiver of a loved one with asthma, reducing symptoms and improving quality of life too. On average, 10 people in the US die from asthma each day. So, I mean, that's 10 people too many today, 10 people too many tomorrow. Asthma is a very controllable and manageable disease. But as we've kind of alluded to, for different reasons, there can be a lack of control, which, again, that's why we're here today to work on improving control and empowering the individual. And then, interestingly, if we look back a few years in 2020, so the COVID timeframe, the deaths due to asthma started to increase. Could this just be a blip and maybe a chance finding? Perhaps. But I think it's really a call to action for us all, pharmaceutical companies, providers, patients, caregivers, to really hone in and focus on our management and approach to asthma care. And then finally, if we look at adults compared to children, what we can see is that adults are upwards of 6 times more likely to pass from asthma than children. And the reasons for that can be multifactorial. Adults have more challenging to treat asthma as they grow up, perhaps access to care, prioritizing one's own care, multiple different reasons. And we'll take a look at some of the other considerations momentarily as far as these disparities in care more broadly. And then if we look at disparities as it relates to males and females, you can see that women are more likely to die from asthma than men. So these are patient populations that we heavily consider as we're thinking about approach, not to minimize children. Of course, we still focus on children, but just recognizing the impact for mortality that can be seen in adults and notably female adults. So as I just shared, the disparity and the burden of asthma still exists today within the US, and this is really going to impact Black, Hispanic, and Native populations more strongly than white populations. And there's not one or two reasons we can cleanly bucket as to why there is a disparity. Patient to patient, individual to individual, it's going to be multifactorial as far as why we're seeing disparities and also working on bridging those gaps and disparities. But I think this slide here does a pretty nice job kind of concisely bucketing different themes together as far as these different disparities go. Some of these might be more front of mind for you, others perhaps not. But just working and calling out a couple left to right here, social disparities in terms of economic stability. We had briefly mentioned the fact that perhaps individuals may not be able to afford their medications because they may need to prioritize food for loved ones, food for children. So they have to consider what they'll be paying for with their paycheck that, they may be living week to week or every other week to ensure care for their loved ones. Um, Additionally, access to quality healthcare is another consideration. So not everybody has access to healthcare as we think about it today, present day. Rural individuals, the access to healthcare can be quite sparse, and there's a lot of initiatives and programs in the rural communities. And even within the cities, sometimes the access to quality healthcare can be limited for individuals. Getting perhaps to a specific specialty provider that may be across town. Racism, discrimination still exists, regretfully, present day. There are different programs out there that continue to work to bridge the gaps and reinforce trust in the healthcare community. But those are still very prevalent to this day, unfortunately. But it's just another disparity, unfortunately, that can really contribute to that asthma kind of gap that we're seeing between these different races and ethnicities. And then just jumping ahead here to the right, behavioral, environmental, and we'll talk about this idea of triggers or irritants to the airway lungs that ultimately lead to some of these asthma attacks or flare-ups, if you will. But smoke, air pollutants, if you have an apartment in close proximity to a highway or to an industry, exposure to these pollutants can be more stimulating for the airway, leading to that irritation. And then, of course, something that unfortunately nobody has control over, we've got biological aspects. So the genetic influence on asthma susceptibility and severity. We're born with the genes that we're born with, from mom and dad, and some of those can be turned on, some can be turned off. And as it relates to the environment, there can be an impact to the environment on the switching on or off of those different genes, but biologic and genetic influence definitely kind of factor into that broader disparity of as it relates to the burden of asthma. And then just dialing in a little bit more, Black individuals compared to white Americans are more likely to experience worse outcomes. So before, again, as we had talked about patient populations that are more heavily impacted, we had talked about adults being more heavily impacted than children, women more so than men. Here, as it relates to race, we're talking about Black individuals compared to white Americans. And across these different tiles here, you can see some of those facts captured. A disproportionate diagnosis in Black individuals, more likely to be hospitalized, which is, again, one of those outcomes that we're trying to reduce and minimize as it relates to improving asthma care, reducing hospitalizations, and also emergency department visits, where you can see that Black Americans are almost 5 times more likely to be visiting the emergency department due to asthma compared to white Americans. And then probably the most staggering is that Black Americans are about 3 times more likely to die from asthma, with the highest death rates in Black women specifically. And this all ties back into the disparities of care that we had highlighted on the previous slide. So before I continue, I just want to take a pause here, give everybody the chance to kind of catch up and digest what we had just talked about and see if there's any questions, if anybody wants me to review anything. And Sandra, if you don't mind, I'll just tap on you to see if there's anything in the chat, just because I currently view it in my screen sharing mode.
Yes, no, nothing so far, Matt. I think everybody's okay. Thanks for checking.
Thank you. Okay. Yeah, no problem. So now we'll hone in on the focus of the presentation, which is the asthma action plan. And essentially, think of this as your playbook or your blueprint as it relates to asthma management. So this is going to be your strategy document, your guidance, and it's a nice resource that between yourself or the loved one with asthma or affected by asthma, and also the provider, you all work together to develop that asthma action plan. And we'll just jump right into it. So this really aims to control and prevent asthma attacks, which is our ultimate goal. So in other words, if we start to feel our asthma is becoming uncontrolled with some symptoms that might be popping up, or I kind of liken it to if you start feeling like you're getting sick, like that tickle that you start to get in your throat, we want to try to get ahead of that as it relates to asthma. So it's really a call to action to start leveling up your care and control based on the discussion and the resources that you and your doctor aligned on, which is your asthma action plan. And importantly, it's worth noting that it's a unique plan for yourself, and your asthma action plan may look different than your friends or loved ones. But really, what it should spell out across the different action plans, yourself, loved ones, or friends, how to manage your asthma daily. So, if things are going well, what should I be doing on a day-by-day basis to continue on that trajectory of doing well? What should I do if symptoms start to get worse? So you and your doctor have outlined a plan of what to do. If they start, getting worse a little bit, what should I do? If they get worse severely, what should I do? And by extension, how to adjust medications in response, what to do when you exercise. So some people might have exercise-induced asthma. So do I need to take a short-acting reliever medication before I start exercising or even get sick? And then who to contact in case of emergency. So again, all these elements fold into the asthma action plan, and we'll take a look at what one looks like on the next slide or two. But again, just reinforcing that this is a collaboration between yourself and your healthcare provider, but it's not stale. And what I mean by that is, like, if you sit down and you work on it with your provider once, that's great, but it should be an ongoing resource that's at least reviewed and potentially updated as you have those touch points with your provider. If everything is working great, let's leave well enough alone. But you and your provider should have eyes on your asthma action plan when you have those touch points with him or her. So it's important that it's brought to the medical appointments and reviewed and potentially updated on a regular basis. So the nice thing about an asthma action plan, and depending on where you look for one, because different respiratory or lung-focused organizations will have their own asthma action plans, but generally speaking, they're all broken down very similarly for how to approach. And it's a stoplight approach, which I think most of us can, if not all, can relate to, right? Green is good, go forward, we're on the correct course of action. Yellow, things are starting to perhaps like get a little bit uncontrolled, or we're starting to get some symptoms. Pause, we need to do something. And then where we don't want to be, but we can get out of, is the red zone. So just building on this, green zone is, we're doing well. It's the course we want to stay on a daily basis. So in this zone, as is highlighted here, you have no symptoms, you feel good, and this is where you want to keep taking your long-term control medications, even if you're doing well. So that's an important point. We'll touch on some of these medications in a little bit. But just because you're feeling well doesn't mean that you should stop taking the medications that you're taking on a daily basis. Those daily medications are what helped get you to this green zone. So keep on that trajectory. And also continue to review the recommendations to stay safe when exercising as applicable and avoiding triggers that can make your asthma worse. More to come on this, but again, the triggers are going to be these things that you're going to work to identify that if you encounter them, you start to have those symptoms of asthma, right? So you start to have the chest tightness, the coughing, and the triggers can be challenging. I'm getting a little bit ahead of myself right now, but the triggers can be challenging because they can vary, not only patient to patient, but for oneself throughout the year. So pollen might be a trigger for yourself in the spring, but then that goes away. And then in the fall, early winter, it might be a virus. So these triggers can be challenging, but we'll talk about the importance of an asthma journal in a little bit to help you hone in on what those triggers are. So we're doing well in the green zone. However, we encountered a couple of triggers in our recent outing, and now, we're in the yellow zone. And the yellow zone means that we're experiencing some symptoms. And this is really where we should start to slow down and follow the steps that we discussed with our provider to prevent our symptoms from getting worse. So in this zone, you'll still keep taking your green zone medications, so your daily inhalers, any other asthma-related daily medications. And then on top of that, you'll oftentimes be taking quick relief medications as specified. So the quick relief medications are really to work to open up your airways and help get those symptoms under control, get you back to the green zone. But generally speaking, the quick relief medications are not something that you take on a daily basis. It's just kind of a as needed to help get you out of this yellow zone and prevent you from going into the red zone, and then get back to baseline. However, if you don't feel better, are getting worse, or in the yellow zone after 24 hours, it's important to follow the red zone instructions and call your provider. So we're looking for improvement in symptoms after taking the quick relief medications. But if we're not getting those improvements, if we're in this yellow zone for more than 24 hours, really it's a call to the provider and follow the instructions, which are listed in this red zone here. The red zone is essentially an indicator that you're experiencing severe asthma symptoms. So that chest tightness is getting worse, the cough, the wheezing, or you could be experiencing an asthma flare up. Again, I don't want to minimize it. It is scary, but we can get you out of these zones back into the yellow and then eventually the green zone. But it's important that you manage this here and now in the red zone to prevent yourself from going back into this zone, and really try to work to understand why we landed in the zone once things improve. So in this red zone, this is where you get immediate medical treatment. If your symptoms are getting worse and the medication is not helping, those quick relief medications, which we're temporarily taking, but you're taking them at the specified dose and frequency as noted by your provider. And it's important to recognize when to call 911. So if you're experiencing any of the danger signs low, this is something where yourself or a loved one, if they're nearby, or a friend, will call. If you have trouble walking or talking because of the shortness of breath, you're seeing this bluish tinge in your lips or fingernails, which is really indicating lack of oxygen. Or if you're still in the red zone after 15 minutes. So you're still, maybe you don't have the blueness, or you don't have trouble walking or talking, but after taking the quick relief medication, you still have that really intense chest tightness, the coughing. After 15 minutes, if you're still experiencing that, time to call 911. So again, just outlining the typical asthma action plan, what to do when, and how to manage as well. And as I briefly touched on, different organizations have different asthma action plans. I'll leave this up here for a moment if you want to scan the QR code. But you can see across these three representative organizations here that they all follow a very similar pattern of green is go, yellow is pause or the caution zone, and then red is that severe zone. So again, I'll leave this up here for just a moment and take a quick swig of water.
Matt, where can we get these forms? Like we just scan the
Yeah.
QR code?
Correct. Yep. So if you scan the QR code, this will link to each of the individual organization websites to access. And these are free downloadable resources. If you go into Google as well and search the organizations like Allergy and Asthma Network, Asthma Action Plan, it should be one of the top hits. But yes, these are all accessible via the QR codes here.
And for example, if you're working with patients, you will need one per patient, and you just keep your action plan like it's a medical record.
Exactly. So oftentimes, what might happen is as yourself or a loved one's having a discussion with the provider, you complete the asthma action plan. Commonly, it's a tear sheet. It might be a digital download, but then one copy will be sent home with the patient or loved one, and then one is generally scanned into the patient's medical record, so it's on file. But again, bring them back just for review and or updating too.
Thank you.
Yeah. Okay. So we've talked about the asthma action plan, but one resource that really builds into the asthma action plan is the journal. So as yourself or a loved one are having those touch points with providers, in really working to review and potentially update the asthma action plan, one key element that's going to go into any updates is going to be the asthma journal. And this is where you can track your asthma journey over time. So there's really two foundational resources to think about: the asthma journal, which really feeds into and helps go into any reviews and updates for your asthma action plan. And on the next couple slides, we'll talk about key elements of an asthma journal and what different sections can look like. But I will call out, similar to the slide that we are just on here, multiple different types of asthma journals. I'll touch on, there's digital, there's paper copies, different organizations, but free resources for you all out there as well. So just want to call that out. If you've seen one, you've seen one. They generally have the same themes. May look a little bit different formatting wise. So, asthma journal. Well, the nuts and bolts of it is this really, as the name implies, works to help collect information about your asthma and feed into the development of the asthma action plan with your healthcare provider. So this is something that you can reflect on and incorporate into your daily routine, perhaps at the end of the night. Maybe you're replacing a little bit of screen time, which I'm guilty of before bed, with some charting in your asthma journal for a few notes on the day. As I had shared previously, you can record this on your smartphone, laptop. This can be written down if that's your preference in a simple notebook. It doesn't have to be anything elaborate. Where it's especially helpful is during periods of worsening asthma. So why it's helpful is because not only is it tracking your symptoms, but importantly, if you're tracking on a daily basis, this can help to uncover potential triggers that may not have been a trigger previously, or perhaps are ones that you had thought about, that after reviewing your asthma journal and seeing the alignment between trigger exposure like cat dander, let's say, or pollen, and then worsening of asthma symptoms, the asthma journal can help connect those two and kind of maybe reinforce that aha moment, right? This can also be used after a change in treatment to monitor your response. So let's go the other direction. We're talking about getting severe, but let's talk about getting better. So let's say you're on a higher dose of an inhaler and you and your provider have agreed that you've had control over your asthma for X amount of months, and the provider wants to step down your regimen to a lower dose of your inhaler. Well, let's see how you do. you could chart those responses over the next couple of weeks in your asthma journal to really hone in and see how you're responding to the step down in therapy and see if you're doing well. And similar to the asthma action plan, it's a resource and tool that you're going to want to bring to your provider engagements or with the asthma educator as well to review and update your asthma action plan. Because again, this journal really feeds into that asthma action plan. So, what does an asthma journal look like? Again, this is just one example on here, but I think it's pretty representative of other ones that you might encounter. There's lots of different sections of it, and we'll break this slide down piece by piece. But at a high level, before going into specific sections, what you can see are different elements of the journal, which include exposure to certain triggers, such as the cat dander, the virus, the outcomes associated with the exposure, any associated symptoms, medication use, and then peak flow readings as well. So I won't spend too much time on each of these sections on this slide because, again, this is a build slide, and we'll look at it more closely. So asthma symptoms and asthma control. So in terms of exposure to these different triggers, whether known or unknown, it's important that you recognize the symptoms of asthma. And highlighted here are the hallmark symptoms of asthma, which are pretty non-specific, but I think they're symptoms that many of us can hone in on as being a potential symptom of uncontrolled asthma. But these include things like coughing, the chest tightness, the gentleman here who's tripoding because he's short of breath, and then finally wheezing, which I think is probably the most commonly associated symptom with asthma, that the challenge with breathing that can be audible or you can hear if you're experiencing it, or perhaps if a loved one is as well. But recognizing that individuals with asthma have a unique experience of the disease involving different symptoms. And just because you have symptoms A, B, and C to one trigger doesn't mean if you're exposed to a different trigger, you'll experience the same symptoms. They can be completely different. And your exposure and symptoms to a given trigger might be totally different from that same trigger in a different individual. So here, just reinforcing that your asthma journey and experience is unique to you. Now, as it relates to the asthma journal, this will be the space where you'll want to identify what signs or symptoms you experienced in response to that given trigger. So did you have wheezing, cough, shortness of breath? In this example here, after being exposed to a given trigger, the individual experienced the wheeze, cough, and then also some activity limitations. So perhaps she couldn't walk her dog as far as she typically would and had to turn around halfway through, right? So those would be considered activity limitations. Sleep disturbance could be another one as well. So just being mindful of how the trigger impacts and results in certain signs and symptoms, that's all captured here. And finally, the slide I've been kind of hinting at for the past 20 minutes or so as it relates to triggers. Again, triggers are the things that you're going to inhale that interact with your airway that lead to those symptoms and signs that patients can experience with asthma. And again, the challenge with triggers is that on average, patients with severe asthma have about 8 triggers. Identifying those triggers can be challenging. Triggers can change throughout the year or throughout an individual with asthma's journey too. So this is very important and why the asthma journal can really help you hone in on what those triggers may be, as you can relate the trigger exposure to symptoms. And I totally recognize this is easier said than done, but it becomes very important as you're talking about management and avoidance of triggers, as well as control of the asthma. But just looking at a few of these here, I think many of us kind of associate asthma with some common triggers like allergens, such as pollen, cat dander. We've also got viruses, but some other ones that may not be as front of mind, strong emotions, laughing, crying, stress, like those changes in the airway may be a trigger for individuals. We talked exercise. That be a certain subtype of asthma, and patients who exercise might experience twitchiness in their airways where they may require certain medications. And I think now more front of mind for individuals, especially in the Northeast too, but are these weather and climate changes. So not only are cold climates perhaps, but also thinking about the wildfire smokes that we've been experiencing the past couple of years, coming down from Canada, the air quality. We'll touch on air quality in a minute, but the impact that weather can have on one's asthma control can be challenging. So the diary can help you so you know how often and how severe you're having asthma symptoms, which is key to managing asthma. In this section here of that asthma journal is where you'd capture those different triggers. So in this individual, or in this the chart for an individual, they noted high pollen count. So this is where you would capture that. Perhaps let's say you went into a restaurant and they just clean the tables, or you're there first thing and you notice that cleaning smell, if you will. That can be another thing that you can chart, because some of those cleaners can have very intense smells to them, which might be irritating for others, or yourself with asthma. So that can all be captured here. And then peak flow. So we really haven't talked too much about peak flow earlier in this presentation. So I'll spend a moment talking about peak flow here. And really, it's nice to have. It's not a need to have. But what's the value in it is that it allows you at home to really assess how well your lungs are working, and if they're landing in either the green zone where we want to be, the yellow zone, which is things are starting to get symptomatic, or in the red zone, which is where we don't want to be. But it is nice because it's a non-invasive, easy at-home assessment of your asthma control. So there'd be steps outlined in your asthma action plan, which would guide you as far as like whether or not to use your quick relief asthma medication, when to seek emergency care, based on the peak flow. So it's nice to have that kind of more objective assessment. Also can help you and your provider make any decisions about your treatment based on, again, some more objective data. But again, nice to have, but not need to have. And the biggest thing here is that if you are going to have and use the peak flow meter, which your provider may or may not have at the office, but they're purchasable if you go perhaps to a surgical supply store. Sometimes pharmacies may carry these as well. The important thing to recognize is that the measurements are based on your personal best when you're in the green zone. So in other words, we want to find out what your baseline is with the peak flow meter. And then from there, we use that baseline to help guide if 2 weeks from today, you do the peak flow and you notice that compared to your personal best slash baseline, you're maybe 70% of that value. So it's important to establish a good personal best baseline, because that will influence and guide future decisions around where you land weeks, months down the road to assess your asthma control. So the green zone would be about 80 to 100% of your personal best. The yellow zone was the example that I just mentioned. So we did our personal best today, which is 100%. That's baseline. 2 weeks from now, after being out and about, lots of pollen, let's say, I'm starting to experience a little bit of chest tightness. I do my peak flow and my lungs are only functioning at 70%, right? So that's just an indicator that, yeah, as anticipated, I was exposed to some of my known triggers. This is reinforcing this. Let me take a look at my asthma action plan, because I'm in the yellow zone, and that'll tell me what to do and when to do necessary treatments. And then finally, the red zone is going to be less than 50% your personal best. And then these recordings can land also in the asthma journal. So depending on what your asthma journal looks like, these can be captured in the morning as well as in the evening, and then recorded to capture what that personal best looks like, as well as your baseline personal best too. So up here, you can see that your personal best for the peak flow is 500. In that 80 to 100% range looks to be 450, 50 to 80%, 300, and then below 50% would be 200 or so. And then kind of, we've thrown out a lot of resources, an asthma action plan, an asthma journal. Is there anything that's like more digestible, more quick, something where I don't necessarily need to have resources at my disposal right here and now? And the answer is yes. So one thing to assess your asthma control is called the rules of two. So if you're not familiar with the rules of two, this is really honing in on whether or not my asthma is uncontrolled if I hit one or more of the following. And these include different medications as well as symptoms. So first, starting in the upper left, if I'm using my quick reliever medication that we had touched on a little bit with the asthma action plan, more than 2 times per week for symptom relief, that's an indicator of uncontrolled asthma. Similarly, if I'm refilling that quick reliever medication or SABA, same thing, more than 2 times per year, that's another indicator of uncontrolled disease. If I'm taking oral corticosteroids like prednisone, for example, more than 2 times per year for asthma control after going to the ER or being discharged from the hospital or even just calling my provider, that's an indicator of uncontrolled asthma. And then lastly, if you're waking up more than 2 times per month because of asthma symptoms, that would be another indicator. So these are all just like very front of mind quick check boxes you can do to kind of identify if your asthma is uncontrolled or not, but it's not to replace the asthma journal or the asthma action plan. Really, it's just a quick check. And if you answer yes to any of these questions, really probably time to schedule a visit with your healthcare provider to further discuss. So before we briefly touch base on the asthma medication use, I just want to pause. Any questions, comments, or things that I can review?
Nothing so far, Ma.
Okay, thank you. So as it relates to asthma medications, the great thing is that there's tons of options out there for patients affected by asthma. And that allows for individualization of treatment. And if one doesn't work, providers can switch to a different agent and really figure out what works best for the individual patient. So all treatment plans are unique. And what you may be on or what a loved one may be on is likely or may be different compared to another individual. But briefly, just touching on some of these, we had just talked about short-acting medications. These are going to be for the asthma attack or asthma flare up. So tying back to the asthma journal, this would be, the asthma action plan. This would be when you're in the yellow zone or in the red zone. You're going to be taking the short-acting medications temporarily to manage the asthma attack. And these oftentimes come in the form of an inhaler. Now, the other typical regimen you'll hear about are the long-acting controllers. Importantly, these are daily regimens for asthma control. And these oftentimes come in the form of inhalers. Not always, but most frequently are used in an inhaler formulation. So unlike the short-acting medications, which you take as needed, notably when you're in the yellow or the red part of your asthma action plan, these long-acting controllers, again, you're taking daily because these are really working to reduce the inflammation and potentially open up the airways a bit for individuals with asthma. If you have a certain type of asthma, allergic asthma, there are allergy medications that can be given, either as injections, tablets, etc. So if you have an allergy to certain types of grass, this might be a consideration for you. It's a discussion with your provider, of course. Biologic medications for patients with difficult to control asthma. These are targeted therapies that are injectables. Those are also consideration. And then finally, for additional asthma control, oral steroids like prednisone can be considered too. And as it relates to the inhalers, which we've talked about for the quick relief as well as for the daily long-term use, technique is extremely important and the right technique for the right therapy. So as I've shared previously, inhalers are the most common treatment for asthma because asthma is impacting the lungs. So really, we need the medication to get to the lungs at minimum. And also, if we think about medication delivery, if we can limit exposure to the lungs only and limit exposure systemically elsewhere, we can really work to minimize side effects. It's not to say it's foolproof, but by limiting exposure to the lungs, only, we're really limiting exposure to the rest of the body, so less side effects theoretically. But without that proper inhalation technique, less of the medication can get to the lungs where it needs to get to. So, looking on the right here at this visual, this is an example here of an individual using the inhaler alone, or because inhalers can be so technique dependent and nuanced, I'll say, what the difference can look like if the inhaler also has this attachment called a spacer device added onto it. And what you can see is that compared to using the inhaler alone, the spacer device, which you can oftentimes purchased at a pharmacy. Maybe your doctor's office has one too. This allows more medication to get to the lung and also minimizes the amount of medication that can be deposited in the back of the throat, minimizing side effects. Compared to using the inhaler alone, where you can see less particles getting down into the lungs and more collecting in the throat, which can lead to certain side effects of the mouth and throat. So, important to recognize you have options out there for your inhaler as an attachment with a spacer device to really improve medication delivery, improve asthma control. But more than 50% of patients use their inhaler without a spacer. So if you haven't had the discussion with your provider about a spacer, it might be worth bringing that up during your next visit. So in terms of taking action, we've talked about being mindful of what you can control. And these slides, I won't go through them in great detail for time's sake, but there are different things that you can do to reduce exposure, notably to indoor asthma triggers. So some of these might be obvious, perhaps some are less. If you have a lot of carpets in your home, ensuring that they're vacuumed or swept on a regular basis, limiting pets in the bedroom, especially if they're your known triggers, avoiding any type of smoke that may be an irritant to you, which it not only includes cigarette smoke, but burning tobaccos, woods, candles, etc., because those all can contaminate the air. And then considering sealing doors to avoid secondhand smoke or even the outdoor air pollution, notably when allergens rise pretty significantly. Similarly, as it relates to triggers and air quality, if you haven't had a chance to take a look at air quality, it might be worth taking a peek at it. And this is something that, because of actually this program, I've started to look at a little bit more regularly. But there are daily air quality reports that, as you're considering your day to day or a loved one's day to day, it may be worth briefly reflecting just to see what the air quality looks like, and whether or not perhaps you should consider a mask outdoors to minimize, it's not perfect, but to minimize the trigger exposure that can lead to symptoms of asthma. Lots of resources on where to locate your air quality. You can look at this website here, airnow.gov. If you have an Apple smartphone, on the weather app, if you keep scrolling down a little bit, you can see the air quality. Where we want to be is in the green, but you can see here for even getting into the orange here for sensitive groups like patients with respiratory disease, that can be a consideration where we might want to limit our time, if not avoid being outdoors for a significant amount of time. So if you haven't taken a look, take a look at the air quality report. And it's just a quick look at it to see how the air quality will look for the day. And then kind of hinging on some of the previous recommendations we looked at 2 slides ago, but lifestyle changes not only go far in the asthma space, but also beyond asthma. Breathing exercises to manage stress. And we had talked about the importance of emotions being a potential trigger for individuals, avoiding tobacco smoke, which will not only limit exposure to known triggers for individuals, but also minimize development of COPD and lower that risk potentially if you're able to avoid it. Healthy weight, if we think about this as it relates to asthma, could make it a little bit easier to breathe with less physical weight pressing down on the chest. But as we all are aware, maintaining a healthy weight, touches on cardiovascular conditions and multiple other therapeutic areas. Healthy sleep habits, way easier said than done. But if you're able to get a full 7 to 8 hours of sleep, that goes far day to day. Importantly, taking your medication as prescribed and not just stopping it without having the discussion with your doctor. If cost is an issue, have that discussion as well. And then again, healthy choices, exercising regularly as tolerated. And then lastly, I'll just briefly leave this up here, but there are other diseases that can impact asthma management. And this kind of circles back to the previous discussion that I had as it relates to that difficult or severe asthma being potentially a result of other conditions. So other conditions like nasal polyps can actually impact the level of asthma control. Similarly, GERD or gastroesophageal reflux disease can also impact asthma control. But beyond that, just considering other conditions as well as it relates to the total patient management. So owning the disease and not letting the disease own you. These are some of the other conditions often associated with asthma, and again, can impact asthma control. So just to wrap everything up, and then again, welcome any questions. Today, we've talked about a bunch of different aspects of things that either yourself as an individual impacted with asthma can do, or you can help pull through for a loved one or a friend with asthma. And that includes understanding your current level of asthma control, the importance of the asthma action plan and asthma journal, and by extension, using the asthma journal to really track symptoms, medication use, triggers, and importantly, outcomes. And then being your best advocate and discussing these things with your providers on the routine follow-up. So remembering to bring your asthma journal, your asthma action plan with you, asking questions, clarifying your understanding, and really becoming your own champion for the management of your asthma. So I'll just leave you with a couple resources here that go beyond some of the QR codes that I previously shared, but there's a lot of links up here that'll take you either to specific asthma-related resources and or more broadly lung-focused resources. But again, want to thank you all for your time today, participation, and welcome any questions that you all may have.
Thank you, Matt. This was very specific. I loved how, you really explain like the different stages of asthma and what to do in each case. If it's, and the color coding makes it really, really easy to understand. So thank you for that. I think that, a lot of people will definitely make good use of this information. And going back to what you said at the end, that sometimes we need to look at the environment, the carpets that we have at home. I have a story to share. I used to live in an apartment that was carpet wall to wall all around. And we moved out of that apartment and my daughter's asthma stopped completely.
Really?
And that made me realize that her asthma was related to the carpet in the apartment, because when we moved out, it just stopped just like
Yeah.
that. And then she didn't have any more. I mean, once in a while, yes, she does, but
Sure. It's amazing too. And sorry to interrupt, but don't get me wrong. I love a comfortable carpet. Nothing's more comfortable under your feet than a cushy carpet. But they can be just such reservoirs for different allergens. And if not cleaned regularly, professionally cleaned periodically, it can be challenging to really get all those different triggers pulled up from the carpet, which, kids are rolling around, cats are walking through. But I'm not blind to the fact that, in apartments, if you want to request changing the carpet to some other flooring, it's not always going to be met. So I recognize that reality and expectations aren't always aligned there, but doing the best that you can with what you have in terms of, perhaps more frequently vacuuming, professionally cleaning periodically. So I recognize that ripping the carpets up isn't an option for everyone, but based on your example, it goes to show the importance of just carpets and awareness, right?
Yeah, exactly. So, I really encourage everybody to look at those triggers because we might be living with the triggers and we don't know, and we go to the doctor and they keep increasing the medication, making changes to the medication. But, we really need to look at those triggers. So I like also what you said at the end, how we keep a like notes of what the triggers are when the symptoms get worse and all of that. I think that as parents, that's very good advice. So thank you for all of your advice always. Thank you so much. And we got some thank you here. There is someone that says that you have been supporting District 27 schools. Thank you so much for the
Thanks.
education that you've done there. And let me see if somebody has raised their hand. So if you don't mind just writing the question in the chat, that would be helpful. Yeah. Any last advice that you have for parents, Matt?
Yeah, I would say, for parents of younger children, especially, they may not, children that is, may not be able to readily communicate or identify that they're starting to develop symptoms of worsening asthma, if not going into a full-blown asthma attack. So I know the list is long as a new parent myself, but just being on the lookout for any additional signs and symptoms and recent changes in a child's day-to-day life, as that child starts to navigate their asthma journey that may have contributed, right? So listening for, normally the kid does this at recess, let's say, but mom, because I wasn't feeling well and I was short of breath or what have you, I wasn't able to participate. I mean, that right there is kind of a red flag as far as a daily activity limitation. So I think just being mindful of some of the things that we may acknowledge day to day, but may not prioritize as far as asthma management. So I guess bottom line, just continue active listening.
Yeah. And we have got a comment here. I had severe asthma for 8 years and it's now under control. Thank God. I'm happy that you said that. I noticed smoking is another trigger. And this person says they struggle avoiding being around people who choose to smoke because, of course, that triggers their asthma. And it sometimes gets frustrating because, people don't understand. And it's true.
Right.
Yeah. Well, thank you so much. This is the end of community chats just for today, not forever. We're gonna be here next week again. We're gonna start June talking about cardiac arrest and how to help somebody who is having a heart attack. And we're gonna learn a little bit of CPR. We're not gonna be CPR certified, but we're definitely gonna know to at least how to provide some help while the ambulance gets there. So if you want to learn more about cardiac arrest and how to help, please join us at our next community chats next week, Thursday at 12 p.m., just like every other Thursday. And thank you, Matt. So nice seeing you.
Thank you all. Thank you, Senator. I appreciate it.
Talk to you soon, everybody. Bye-bye.